I'd like to thank everybody coming out this morning. My name is Rocky DeStefano. I'm the business manager of the Painters Union here in Western PA. We have 32 counties. I'd like to welcome Representative Jason Ortitay to speak on the House Bill 981. It's Construction Opioid Awareness Week. And not just our union, but a lot of unions have the same problem. So I appreciate what he's doing for us. Jason?
Thank you.
Okay.
Thanks, Rocky, and good morning, everyone. We're here to officially kick off Construction Opioid Awareness Week in Pennsylvania, which started yesterday and runs through July 28th. Before we get started, I'd like to thank Rocky and gals of the Painters Union for hosting us here today. You guys have been great to work with, and I know you guys were really excited to host this event today, and I really appreciate your work. You guys done a fantastic job. A couple years ago, you gave me the opportunity to tour this facility, and it's top-notch. It's fantastic all the way around. You guys do a great job. I'd also like to take this time to recognize some of my colleagues from the House who are here with us today. We have Representative Anita Kulik, Justin Walsh, Rick Saccone, Jim Marshall, Pam Snyder, and Harry Reedshaw. I think I got everyone. Good, good. Thank you guys for being here and taking time out of your busy schedules. Really appreciate it. Last month, the House unanimously passed House Resolution 981, which is Construction Opioid Awareness Week in Pennsylvania. John O'Brien of the Keystone Contractors Association brought this issue to my attention, which brought about the resolution. We are here today to help raise awareness and help people in the construction industry understand the potential dangers of opioid and prescription drug abuse. It's peak construction season in our state, and you don't have to look around too far to see where all the jobs are and where all the heavy equipment are. The hardworking men and women who work construction without a doubt feel aches, pains, and soreness every single day. It's tough, grueling work during the hottest part of the year. So it's important that we take care of these people and give them all the tools and resources available, and that's why we're here today. So just a little bit of background information. A June 2017 study by the Workers' Compensation Research Institute found that out of 26 states studied, Pennsylvania continued to be among the highest claims with opioids, including the second highest amount of opioids prescribed per injured worker, the second highest number of opioid pills per prescription per claim, and the second highest amount of opioids per pill, which is about 10.2 milligrams. Business insurer CNA reports more than 15% of workers in the construction industry have a substance abuse problem, compared to less than 9% of workers in other industries. So you see that it is much more relevant in the construction field, which is why we're bringing this resolution to a front. So that's why it's important that we do everything we can to make all construction workers aware of the tools and resources available to them to avoid addiction and opioids whenever possible. So today we have a great lineup of speakers. I've asked every one of them have some great resources to share with us, but we're going to get started with Brian Urbinko, who is the director of the IUPAT Council number 57. So Brian, come on up.
So good morning, everybody, and welcome to the IUPAT. This is an organization I love. Thank you, Representative Ortitay, one, for giving me the privilege to speak, and two, for being a part of with the legislators that unanimously passed this resolution. You heard the figures; they're astounding. It is crazy how many people are affected by this, especially in the construction industries, and you heard the reasons why. I also bring a personal element here. I have people who I love who have been affected by substance abuse. So I have kind of the experience and some education, but the unfortunate part was when the substance abuse of those who I love hit me in the face, I wasn't prepared and I wasn't educated. And what's true in so many fashions, especially in human nature and in America, is we tend to be a little bit more reactionary. We wait for things to happen, we figure out how to solve them, how to deal with them. That's why I really like this House resolution, because it kind of faces the problem ahead of time. Bringing resources to, and having resources available to members in the construction industry and really within the state, to say, if I don't want to take opioids, what can I do? So again, being proactive is always much better than being reactive, especially in a situation like this. I'd like to share a little story real quick, and then I'll get into some of the resources we have available. I had taken over this position in 2016, shortly after. An apprentice called me, and I'd never met this apprentice. Usually it's a question about a training or how do I get my raise or something like that. He had never met me, didn't know who I was. His first words out of his mouth were, I just got out of rehab. I'm living with my sister who is in active addiction. If I stay there, I'm probably going to die. Can I come in and just hang out? Hopefully anybody would just say yes. So I did, obviously because I have experience with it and I know the dangers of someone like that living with someone in active addiction. So he came in, and obviously a couple of weeks we talked. At that time, we didn't have any work available for him. Eventually, through the help of our leadership, we did get him back to work. But we weren't ignorant to the fact that sending him back into construction field could certainly be bad. And it was. This apprentice is no longer with us. He did succumb to addiction. And since then, we've probably had 4 apprentices. So it's something that, again, is very near and dear to my heart. It's something I'll always be actively speaking about. I'll certainly offer any help to anybody who needs help with it. But let's try not to remain ignorant on this, please. So through our apprenticeship, it was shortly after that I was, now we have a drug and alcohol awareness in the curriculum with all apprentices, and I believe all the trades do. But then shortly after that, with my colleagues in Philadelphia, through a state grant, began what's called ATAP, Allied Trades Assistance Program. And they came out with basically an online training. That was kind of the first step. And that is now in our curriculum. It's a very good training as far as online trainings can go. It's probably one of the most real trainings I've seen. Every one of our apprentices is required to take it. And the feedback we get from it is pretty good. It opens their eyes to a lot of things they didn't know, expands on some things maybe they did know. And the hope is that it can help them identify possibly these problems before they start to manifest into addiction. So again, the parallels between what we're trying to do and what the state is graciously doing, to me, again, is very important. So they're required to do that, and ATAP is also working on a program, basically a peer advocate, where you have almost like a foreman or a steward on a job. Maybe one person who has very specific training on how to deal with these issues, hopefully on every job site, so they can identify and offer the resources necessary, again, before these problems even manifest themselves. So with that, I'm going to wrap it up. Again, thank you all. Thank you, Representative Ortitay. There's some literature on the back table of basically what we're doing. If you want to educate yourself, please feel free to take anything back there. And feel free to ask me any questions or anything afterwards. So again, thank you. Thank you all for being here.
Thank you, Brian. Next up, we're going to have Bob McCall from the director. He's the Director of Safety at the Master Builders Association of Western Pennsylvania. Bob?
Thank you. Good morning. Thank you all for being here today to discuss this important subject in the construction industry. In my role at the Master Builders Association, I assist our members. We have approximately 100 contractor members. I assist them with their safety programs. I help out our affiliated unions to help them with their safety programs. So I'm down in the trenches. I see this every day. I get to see what's happening. And this opioid problem, we deal with it every day in construction. It's a real issue for us, and it's a real issue for everybody. If you think about it, it's really hard to turn on the news nowadays and not see a story on something regarding opioids. It's everywhere for us. In fact, the National Safety Council reported that in 2016, 64,000 of our neighbors perished from a drug overdose. 42,000 of those were a result of opioid abuse. About 116 a day are dying from opioid abuse in this country. That's the significance of this problem. 1 in 4 Americans have been directly impacted by the opioid crisis, yet 40% of us don't feel that our families are at risk, and they could not be more wrong. Everybody's at risk for this problem. And the construction industry has been particularly hard hit. We all know that. There was a study by the Midwest Policy Institute that said that in the Midwestern states alone in 2015, nearly 1,000 construction workers died from opioid overdoses. It's just a terrible problem that we have. The amount of money being spent on opioid prescriptions in construction is stunning. Some 20% of all prescriptions are opioids in construction. That's about 10% higher than any other industry that exists in the country. But I mean, these numbers are shocking. We all know that these numbers are important because it helps us understand the problem. But the truth of the matter is, there are faces behind these numbers. These are real people. These are our children. These are our mothers, our fathers, brothers and sisters. There are painters and drywall finishers and our other trades that are out there doing such wonderful work for us. And they're real people. And it's important to remember that when we hear all these statistics, that there's a face to those. In addition to my role as Director of Safety with the Master Builders Association, I also have the honor of serving on the Board of Delegates at the National Safety Council, and really proud of the work that the National Safety Council has done in leading the opioid awareness efforts throughout our country. In January, they came into Pittsburgh with their opioid memorial wall, and I hope some of you had the opportunity to get down to the University of Pittsburgh and see that. Just a stunning display to put the faces, the stories behind it. They had a wall with 22,000 pills where they engraved individual faces of people who have died from opioid overdoses. They had a story of where they had a display of football equipment, shoulder pads and a uniform of a young high school football player who suffered an injury during a game playing a sport he loved. He was prescribed opioids, and eventually he perished from opioids. That's how easy it can happen to us. Then they brought up the mother who just out in Johnstown told a story of her son who was actually a construction worker, and when he had an opioid problem, he seemed to have kicked it. One night he went upstairs, he put his son to bed, said goodnight to him, came downstairs, said to his mother, "I'm going for a walk." Okay, I think we know where this story is going. He met his dealer. He got some heroin laced with fentanyl, and he died that night. Never came back home. So these are real stories. These are real people that we have to remember behind all these statistics. With the National Safety Council being the leader in this, we have some great products that I hope everybody will take advantage of. We have these prescription disposal bags. Okay, these are all products that are free of charge. You can go on National Safety Council website. You can get these sent to you. You can take your prescription pills that you don't need anymore, throw them in these bags and mail them back, and they're destroyed by Stericycle, which is a partner in this effort. This is really important. There's actually cities in the United States that are finding detectable levels of opioids in their drinking water supply from people flushing these down the toilet. So there's actually a real problem with this. So don't flush them, don't throw them out, dispose of them properly, and that's available to you. We also have available these Warn Me labels. These are little labels that just go on your healthcare card that said "Warn me about opioids." It opens up a discussion with your healthcare provider so that you can discuss the pros and cons of using opioids with your healthcare provider. So those are some of the things that are available. I hope everybody takes advantage of them. But most importantly, I think everybody in this room needs to take the time to be leaders in this subject. You know, we as employers can take the lead. We can do more than we're doing already. You know, employers take the lead oftentimes before there's laws set out. When there was no safety laws, the employers in this area, you know, created safety programs to protect their people. And we as employers can do more to help out our employees. Labor is great leaders, and they're doing wonderful work. Okay, we can always do more to help out. The representatives in this room from Harrisburg, you know, some great leaders are helping us out, and this is a great thing that we're doing. We can always do more. Washington, D.C., they can, of course, do more. You know, this isn't a Republican-Democrat argument. This isn't a red state, blue state. This is a human thing, and everybody can get behind this, and I hope that we can do this. I ask that you know, we do some things. First of all, as a safety professional, okay, one of the things we can do is go to the root cause of this. Okay, we can stop people from getting hurt. Okay, if they don't get hurt, they don't need opioids. We're very proud of our safety record here in southwestern Pennsylvania in the construction industry. We do a fantastic job. We're way ahead of everybody else. Okay, but until we drive that number down to zero, we haven't done everything we can do. So we can do more. We can ask that the folks out there have the conversations with people so that we reduce the stigma of asking for help. Okay, we have Lytle Behavioral Health in the room with us today, who helps out many of our unions with their assistant programs. Okay, they're available to us so that we can actually have these conversations and encourage people to have these conversations to reduce the stigma of getting help. And we can increase access to affordable treatment that our folks need so much. So I ask that everybody just get involved, take the lead, have the conversation, and realize more than anything that it can happen to any one of us. Okay, it doesn't doesn't happen to drug addicts. It doesn't happen to low-income urban people. It happens to everybody. It can happen to any one of us in this room at any time. So be aware of the problem. Have those discussions with people. Okay? Thank you for your time.
Thanks, Bob. Next up, we have David, and I apologize for mispronouncing your last name, Daquilente. Thank you. He's the Executive Director of the Ironworker Employers Association of Western Pennsylvania. Dave? Thank you.
Thank you. Morning, everybody. Appreciate the opportunity to be here today. Representative Ortitay, the work that you're doing and representatives here to help promote this as an issue is critically important. Bob mentioned some terrific statistics about the construction industry and the opioid problems in general. I'll talk a little bit today about what we're doing locally and what we've been doing locally to combat this and other substance abuse issues. So I come to the Employers Association here for the ironworkers, having spent nearly a decade at Mobile Medical Corporation, which is a local third-party administrator that provides substance abuse testing and program management here in Western Pennsylvania and other parts of the country. Before that, I was in the trades. I was a carpenter, and before that, I had a psychology degree that I thought about going into some clinical settings. So I come at this from an interesting perspective and a little bit of an all-around concern for our friends, families, coworkers, and our communities. But in Western Pennsylvania, historically, the substance abuse programs started here in a non-government capacity in the late 1990s with the electrical workers, the National Electrical Contractors Association, and the ironworkers, the Ironworker Employers Association in the late 90s, and in around 2000, the Master Builders Association created their own program with some of the other craft and trade, and that flourished in the early 2000s, really putting a tightening hold on some of the issues that were going unchecked. As Bob mentioned, we can all be leaders, whether it's the contractors and the employers or whether it's labor. And together over the last 2 decades in this area, we've really done that. In 2013, there was a concerted effort to create more of an umbrella program in this area and a unified message going forward. And that falls under the Builders Guild of Western Pennsylvania and the Western Pennsylvania Construction Industry Drug-Free Partnership Program. If anyone in the room can come up with a better, shorter name and a better acronym, please see myself, Jeff Novers, or Bob McCall. We're always looking for something better. But the intent behind this program is that it does create a unified message. It allows the crafts and the trades or the apprenticeship programs to have individual differences. Most of them surround the disciplinary procedures. But the core of these programs is to identify, to test, and to detect for those things that are really impacting a safe and productive workplace and the employees and the communities. In 2013, when it became a unified program, the addition of synthetic opiates and opioids were added to the panel. In the first 2 years that those were being tested, opioids quickly became the #2 substance detected behind marijuana, which historically and nationally is always typically right up there around or at #1. In the last 2 years, so now we're into year 4 in terms of testing since opioids have been a part of this, those numbers have been cut in half by 50%. And I think that's attributed to a lot of elements of the program, some of which have been mentioned here today, which is education and outreach. It's critical, whether it's at the apprenticeship level or whether it's with journeyman or field supervision. So alcohol, drug, and education is an important part of it, as well as member assistance and employee assistance programs, which are a part of all of these programs as well. The emphasis is on the person and their struggle with addiction, and not necessarily looking at them as another piece in this labor equation of a construction project. So identifying those that have an issue and connecting them with the resources that have been talked about today, as well as the employee assistance or member assistance programs, is a huge step. With us, I mentioned Mobile Medical. We've got a representative, Kelly Wilhelm, here with us today. We also have a representative from Lytle EAP, who works with most of the craft and trade in this area. Cheryl Lucas is here as a representative, and they do a terrific job of evaluating those with a need, whether it's related to substance abuse and opioids specifically, or anything for that individual or their dependents and their family. Providing an evaluation and an intake gives us the opportunity to help them in a more holistic level and provides them the opportunity to return to work, return to their families, return to their communities in a much more safe and productive way. Talked a little bit about the state of Pennsylvania, some of the statistics that Representative Ortitay spoke about, and Bob did as well. This is not just a construction industry, although we're here to talk about that specifically today. It impacts all industries. The grueling work that our craft and trade do is no wonder that they're getting injured, and no wonder that those workers' comp statistics are where they are from a prescription standpoint. It's nice to see in the last few years the American Medical Association has come out with guidance on the length of prescriptions and limiting those prescriptions to a short number of days, 5 to 7 days, and the amount of pills within those prescriptions is also key. The face of an addict is not what you may have in your head, and I think Bob mentioned that while 70% of the workplace has struggles with addiction, 40% of us don't believe that we actually have a problem in our communities or in our workplace. And so it's about changing the culture and changing the perspective and identifying that the person struggling with addiction is not just the strung out junkie with a sign sitting on the corner in Liberty Avenue. It's the athlete that maybe blew out an ACL and became addicted. It's the soccer mom that may have had a root canal, something as simple as a dental procedure, and they become addicted and go down that spiraling staircase. So it's important that we look at changing the culture, not just those individuals with the problem of addiction. Allowing an environment that is welcoming to talk about it and reduces the stigma is just one of the many ways that we can help combat this. Bob mentioned something that I think is key, and from his perspective as a safety director, it's crucial, is the best practices in safety and helping to avoid these injuries that cause these problems. But as a Contractors Association and working with our members, looking at how you're managing your workers' comp plan and how you're addressing your panel of physicians and making sure that they're aware of what your initiatives are and they're involved in what the education is another key step that I think employers can do to lead the way. So in closing, I'd like to thank the representatives here, including Representative Ortitay, for this resolution. I think it's important that we return our coworkers, our friends, and our families back to the community in a healthy and safe way. So if there's anything that I can certainly do from a resource standpoint, we're getting information out to our members. Please don't hesitate to ask, as well as some of the resources we've got in the room. So thank you.
Thank you, Dave. And I think we all agree that awareness is step one. As you can see, there are some posters that are up here. There is material in the back, as Brian had mentioned. These are very easy things that we can do to help make people aware of the problem that's out there. And I intend to introduce this resolution every single year. This is not a one-time thing. I'd like to thank my colleagues in the House for supporting it. It's truly a bipartisan effort, and I certainly appreciate that. I'd also like to thank the Painters Union for hosting us today and all of our speakers for sharing their resources. And hopefully no one's shy out there. Ask a lot of questions. I hope all of the members of the trades and the unions in the area take this seriously, have up all the posters, hand out the Warn Me labels and the postage envelopes, and we take care of this problem, and we finally take the fight back and win this fight. So thank you all for being here. Really appreciate it. This was a great way to kick this off, and thanks for being here.